Hi everyone, welcome to Class 2. Class 2 is going to address yoga and stretches for the head, neck, shoulders, and upper back. But I wanted to kind of review what we talked about last time. So last time we did 3 stretches that are very much helpful for the neck. And that was the upper trapezius stretch, levator scapula stretch, and scalene stretch. So the upper trapezius stretch is where you're going to listen to your armpit. So you bring your ear to your armpit and use your hand to deepen the stretch if you need to. The second one is the levator scapula stretch, which is where you bring your nose to your armpit or smell your armpit and use your hand again to deepen the stretch. And the last one is the scalene stretch, which is where you bring your head to your shoulder and again you can use your hand to make the stretch more if you need it. But we also talked about in the instruction section how musculoskeletal disorders form. Usually they're started by some kind of a risk factor, like improper ergonomics, or you're just working really still and really clenched for a long time, really tight. And this leads to muscle imbalances and fatigue. Eventually, those imbalances and fatigue lead to ischemia and necrosis. And necrosis is tissue death, and ischemia is when you get a lack of blood flow to a muscle. And this can lead to pain, and the pain leads you to have these protective muscle contractions that aren't normal. And it can lead to nerve compression, such as carpal tunnel, joint hypermobility, spinal disc damage, and other things. And this is the root cause of musculoskeletal disorders. In short terms, as you work through pain, you're more likely to cause injuries and experience more pain. This course disrupts the process of the ischemia and necrosis. So we can't always control risk factors. Some of them we can control. We can have good ergonomics. But when you're in a really, really hard procedure, sometimes those static, prolonged postures just are what they are. So we're going to disrupt it at a different part. In that musculoskeletal disease formation, we're going to disrupt it in the ischemia, which is lack of blood flow, and necrosis section, which is tissue death. And that's going to be done by exercises, stretches, and yoga poses that specifically target those areas and bring blood flow and oxygen back to that area. Currently, research is showing that yoga and stretching really benefit dental professionals. So hopefully as we continue on this course, you'll feel that way and experience the benefits. I wanted to make sure, again, I'll say this every time, but especially during this course, make sure your movements are controlled. This is to avoid injury or harm, especially as you're following along with my exercises. Don't be flopping your neck all over the place or just wiggling randomly. Make sure every movement you do is really controlled. And then if you have any questions or if I'm teaching anything incorrectly, please let me know. My email is jweb303@gmail.com. Thank you so much, and I hope that you enjoy this class.